Hi YouTubers, this video is to address plantar fibroma. I have a short-term solution and a long-term solution to fix it completely, potentially. So I would like to explain the short-term solution first and then explain how accidentally I cured myself of this. And recently, unfortunately, it came back, but it was cured for about 4 years. So I'm going to tell you what happened that cured that accidentally, and I'm also going to explain to you how you can do a short-term solution. So first, let's talk about the short-term solution. All right, so what you want to do for a short-term solution is make an orthotic for yourself. You can have that made professionally, or you can do it yourself. So you need to get the relief of the pain off the bottom. Mine's right in the arch right here. I can feel it has grown back. Good on the good side, it's on the small compared to what it was years ago. And I'm not even sure if it came back in a different place. But anyway, what you want to do is take a drop of oil and put it right on it. And first of all, I'm sorry, you want to get, what I get is I get a Spenco insert pad like this. Then what you're going to do is you're going to put the pad in your sneaker in a correct position, and our goal is to make a hole like this. And you might even want to have 2 of these. So this will help you to relieve the pressure on your fibroma, but I'm going to show you how to locate the hole. So you put this in your sneaker, and then what you're going to do, the way that I've come up with it, I don't know, maybe you can figure out a better way to mark it, but the best way that I have is you put just a tiny drop of oil right over that, and you can use mineral oil, you can use cooking oil, anything. You put it right on it, and then you carefully insert your foot into the sneaker, and then you stand up and press down with the middle arch, and that'll make a mark on the insole. In this case, it's a Spenco pad. It makes it kind of a grease mark, and then you can cut a hole around it, the size roughly of your fibroma. Now, so that's instant orthotic, easy to do relief. So I recommend doing that. And the second thing I recommend is getting verapamil, which a lot of people say doesn't work and some people say it does. I'm going to tell you what I think. The verapamil didn't make my fibroma go away, but it did make it stop growing and relieve the pain and the ache of it, so I could do walking sports. I'm not a runner, but I could play golf and things like that. Now, let's just talk about the long-term solution. The long-term solution is time-consuming, but and I don't have a lot of information on it. Here's what happened to me. I have bad ankles, and I had ligament surgery right here. Okay, so I have a ligament this way, and there's one this way, and those 2 ligaments were tightened. Now, that doesn't have anything to do with the fibroma on the bottom of the foot. But what happened was, when you have ligament surgery, you have to stay off your foot completely for 6 weeks. And I was in a cast, I think, for 4 weeks, or 4 or 5 weeks, and then in a boot for 1 or 2 weeks. So think of it this way. It's really unrelated to my surgery, but I think what happened was just staying off my foot completely, 100% completely, for 6 weeks in a cast did the trick, and it went away. And it has, I could feel a tiny something there, but it was huge before the operation. And after he took my cast off, miraculously, I didn't even realize it for about a couple of days. But I was walking around, and then I was at night, and I said, "Oh my God, my fibroma's gone completely." And well, I don't know if it was completely. I could feel something there, but it was unbelievably better. So perhaps what you could do, if somebody has the interest to try the long-term solution of putting their foot in a cast or staying off of it for 6 weeks, maybe you could post something to this YouTube and comment that you did it and it worked or didn't work. I think a lot of people would appreciate that if you're willing to take the time to do that. And I think there's a lot of people out there that might be willing to try that long-term solution because it's so difficult, this problem. All right, well, thank you very much, and good luck with your fibroma. Oh, one thing on the verapamil, I forgot to mention. If you do get verapamil, make sure it's very cloudy. If you get it from a pharmacy that makes it suspended particles in a gel, it's not going to work. The only one that works has to be incredibly ground up, and I don't know how they do it, but the lab that I got it from has it. I don't want to say the lab because I don't want to sound like a commercial, but the lab I got it from it cost about $150 a tube per foot, or at least for 1 foot, and then you can. It's very cloudy and it's incredibly well mixed into the gel. So it's usually like, I think it's 15%. Okay, well, good luck. So I just wanted to mention the quality of the verapamil. Otherwise, it's not going to work. I've seen a lot of people. There's a lot of controversy in the web about the verapamil, and perhaps the reason for the controversy is a lot of pharmacies don't make it correctly. So you need to get one that is absolutely. It totally looks like a uniform gray color, or I think that's the color, grayish white. If it looks like I said, speckles inside of a gel, then that's not going to work, because I've had both kinds and I can tell from experience. Okay, well, thank you very much for listening, and good luck.